As respiratory illnesses continue to surge globally, St. Lucia's Ministry of Health, Wellness and Elderly Affairs is closely monitoring the situation. Recent media reports have highlighted rising cases in Influenza A, HMPV, Mycoplasma pneumonia and COVID-19, particularly in China, placing significant strain on the healthcare systems. Closer to home, the flu season is in full swing across the Caribbean, with increases in Influenza A, RSV, and COVID-19 strains. The ministry is urging residents and visitors to stay vigilant, especially with the peak of travel season upon us. Dr. Sharon Belmar-George, the Chief Medical Officer, shared an update on the health situation and its effect on our region.
The Caribbean region and St. Lucia is presently in the typical flu season, with notable increases in respiratory illnesses among the population. We are also experiencing peak travel and visitor influx. We note increases in Influenza A, cases of respiratory syncytial virus and COVID-19 variants.
The Chief Medical Officer further outlined the measures the ministry is taking to prevent a potential outbreak of respiratory illnesses.
In the interim, the Ministry of Health is closely monitoring the situation and focused on strengthening the national capacity and response for the potential spread to other countries by increasing the disease surveillance system and the local capacity to detect and manage cases.
Dr. Belmar-George continued by emphasizing steps to minimize the impact of respiratory illnesses.
The public is encouraged to reduce the impact of respiratory illnesses by the following measures. Maintain a healthy lifestyle through diet, regular exercise, adequate sleep, reduced stress and toxic habits. Ensure compliance by taking prescribed medication if you suffer from any chronic health conditions. Strengthen sanitary measures at home and at work and maintain proper hand hygiene with regular hand washing. Wear a face mask when presenting flu-like symptoms and consult a healthcare professional if flu-like symptoms linger or worsen.
Dr. Belmar-George encouraged individuals with chronic health conditions to wear a face mask in public and to steer clear of contact with those who are unwell. She also emphasized the vital role each individual can play in helping to reduce the spread of respiratory illnesses.
Personal responsibility is important at this time. The Ministry of Health also reminds the general public that we are presently in the flu season, which runs from October to March, and as such would like to encourage the use of the flu vaccine, which is available at no cost to the public at the various wellness centers.
Dr. Belmar-George emphasized the importance of taking preventative measures, sanitation, good hygiene, and staying home when sick. The Ministry of Health is working tirelessly to ensure the healthcare system remains prepared, but the public's cooperation is crucial in limiting the spread of these illnesses. Stay vigilant and take the necessary precautions to protect yourself and those around you. For Choice News Now, I am Darrell Lionel.